Hi, I'm Rohrich. I'm a board-certified plastic surgeon in Dallas, Texas, and welcome to the Rohrich Knows podcast, helping you become a better and more informed you. Well, let's talk about Taylor Swift. Of course, she's all the rage. She's an amazing American singer, songwriter. She's an actress. She's an influencer. She is the bomb. She's been all over the world. Her recent tour is like one of the most successful tour in the world. It's just been sold out everywhere she goes. It's unbelievable. You know, a lot of my staff have seen it. I've never been to one of her live concerts, but I hear it's phenomenal. I mean, she began songwriting at age 14. It's unbelievable, and she's had hit after hit, multiple Grammys. She's really swept the music industry, you know, and I think it's her unique ability to convey emotion and captivate the world through her storytelling, through her life. And I think that's been amazing. You know, she was earlier she was country, now she's pop and indie, and she just has had just chart-topping albums year after year, month after month. I mean, she's amazing. And I think the reason as a plastic surgeon I'm talking about her is because she's a true influencer. She kind of says what she thinks and thinks what she says, and I think that's pretty amazing. And I like her, and I think that a lot of people have talked about Taylor Swift, you know, what plastic surgery she's had, the before and the afters. And I'm just here to tell you, as a plastic surgeon, first of all, I'm just going to give you my opinion. I'm not a plastic surgeon. I think she's a beauty. She's a natural beauty. And I would tell you, I'll give you the short answer to the long version, is that, has she had a lot of plastic surgery? I don't think so. I know people talk about all the things she has done, the rhinoplasties and the blepharoplasties and the brow lifts. I don't think, when I look at Taylor Swift, she hasn't changed dramatically except for aging, you know, since her photos when she was 14 and 15 to 2023 when she's 33. Yes, of course, she's had obviously, she has great makeup, she's got great eyelid appearance. Has she had a brow lift and a blepharoplasty? I would say possibly, but I don't think she really has had much done in plastic surgery. She's had the normal amount of Botox and fillers that I think, you know, almost every one of us has had. And people talk about her rhinoplasty. If she's had a rhinoplasty, and I'm an expert in rhinoplasty, it was a very subtle one and one that was very, very minimally done. You know, and I would say that whoever did it, if she has had a rhinoplasty, it was reasonably well done, and I just don't think she's had a rhinoplasty. I think that all the photos you see have makeup on, different views, different lighting, so I don't think she's had anything significant done other than what I'd say the non-invasive things. You know, she takes good care of herself, and she looks great, and she knows and how to put on makeup and how to do it well. So I really think I'm just going to push back from all the people who said she's had all this blepharoplasty, rhinoplasty done. You know, I would say that if she's had if she's had anything done, it's been very minimalistic, which I think fits her personality. So I think that's good, because less is more. And somebody who's youthful and who looks beautiful as she is, I don't think you need to do a lot to look good. And I think that her makeup looks really good. And I think, you know, if she's had a blepharoplasty, it's been minimal. If she's had a rhinoplasty, it's been very minimal, so because she still has her characteristic look, you know, of her nose, and I think that that's a good one. So she hasn't had it like streamlined. She hasn't done anything like the Kardashian six-pack that so many of them have done. So I think that that's a good thing, because she's very smart. She's sassy. She really knows what she wants, and I don't think she wants to look good, but I don't think she bows to anybody's influence of saying, hey, you've got to do this, you've got to do your nose. And I think that's a good thing. And as a plastic surgeon, I like those kind of patients, because I think she knows what she wants, and she looks good as she is. So I don't think doing a lot of things that you sometimes see other aging stars and singers and songwriters do looks good. And I think she's learned that lesson. She's very smart. She's a smart businesswoman. So I think that, if anything, I think she's on the right track. And she's, she's a phenomenon. She's a game changer. She's an influencer. People love her because, of who she is. And I think that, in her face, I think she's looks remarkably excellent and youthful. And I think that's what you want to do. So whoever's doing her neuromodulators and her fillers, kudos to them, because I think that they've been subtle, they look good, and that's really what you want. You don't want something crazy. And I think she wouldn't allow you to do that anyway. So this is a 2 thumbs up to Taylor Swift on a minimalistic approach to aging and just looking as good as you feel and rocking on. So I would say less is more, and I think she should keep doing what she wants. So please send me your comments. I know I've read so much about the things she may have had done or not done, and I would just dispute most of that. And I, as a plastic surgeon, applaud her for doing that, because she's somebody that really doesn't need a lot to keep looking good. Now, if she ages, of course, there are other things she can do. So give me your thoughts, give me your comments, and stay tuned for helping you become a better you. And this is quite a role model.